Bendigo's poppet heads and its subterranean city of mine shafts is a legacy of its foundation of gold. The men who worked in the mines, however, suffered from miners' phthisis and tuberculosis. In the early to mid-1900s, men were dying prematurely, leaving a legacy of impoverished families. In the 1950s and 60s, the people of the Eaglehawk and Long Gully district were especially struggling. Not only was their health poor, but they had grossly inadequate health services. Community health in Bendigo starts with the needs of those families.
My experience as a district nurse, I knew that just from my own anecdotal experience that the health status was poor. But when the statistics came through, it was even poorer than we thought.
That's right.
And there was really a health scarcity in Eaglehawk. There were not enough services to provide medical and health care.
Yep.
Kangaroo Flat was not far behind. Kangaroo Flat was also a health scarcity area.
Yeah.
And this population, Eaglehawk and Kangaroo Flat, they suffered the greatest burden of illness and poor services in the wider Bendigo area.
And you couldn't get a doctor. It was very hard to get a doctor because there's only one or two in Eaglehawk at the time, because doctors didn't come and live in Eaglehawk. They lived in the rest of Bendigo.
That's right.
And it's very hard to get a dentist. In fact, I think at the time there was no dentist at all.
There was
in
no
Eaglehawk.
dentist, and one of the doctors was part-time.
Yes.
And so, yes, the services were very scarce, and people didn't even look to find services. They just had to suffer their illness in the best way they could.
In the early 1970s, under the leadership of Gough Whitlam, the Labor Party, while in opposition, was developing a broad sweeping program of social reform. Apart from education, one of their major tasks was to create a community health program that, for the first time in Australia, embraced the need for free and accessible health services to people from communities across the social spectrum. As the federal member for Bendigo, David Kennedy was a crucial link between the health policy and its implementation in Bendigo.
David's role was absolutely crucial. David had the knowledge and the insight into the policy of community health for Australia.
David, I can still recognise.
As part of the 30th anniversary celebrations of Bendigo Community Health Services, David Kennedy revisited the early days with former Prime Minister Gough Whitlam. David was left in no doubt that at 88, Mr Whitlam's wit was still as sharp as a razor.
You never got any decorations, did you, David?
Very sad. I didn't actually think I actually deserved them, really. I didn't have the right people in government, Gough, for long enough.
David and Mr Whitlam went back to the heart of community health policy.
And Gough Labor in opposition actually had a quite well-developed program, not only of health in general and Medibank, but on community health as well.
Very early, I've looked it up, it was on the 8th of March 73, Doug Everingham was asked a question about what's happening about the health and the services. And he said, we believe that there must be far more emphasis on community health care, on preventive care, and on keeping people out of hospitals. Well, of course, we're often remembered as a government for having abolished fees for hospitals, which we achieved at the end of 75. But of course, we always emphasised not only hospitals, but health services.
How radical, Gough, do you think the whole idea of community health centres was when you brought it in 1973?
Well, it was very novel, really. I remember when our kids were born, we'd take them to the baby health centre.
Yes.
And there was that provided by the state governments. Clearly, it was not just baby health that you needed, because other community issues were alcoholism and poverty and violence, marriage relations.
Indeed.
You really, in our view, had to develop these things more closely than through state governments.
That's right.
You had to do it with communities.
In October 1973, the Eaglehawk Borough Council called for a public meeting, which overwhelmingly supported the new government's health initiatives.
We had limited doctors in Eaglehawk at the time, and this is just what we wanted as a community, and of course the Borough Council were right behind anything in that regard.
In November of 1973, the government announced that the newly formed Eaglehawk Community Health Centre Committee would receive $200,000 for a major overhaul of community health.
I was always confident that the thing was going to work, in that the Commonwealth Government had come up with the idea, the Commonwealth Government had supported it, had some pilots running in Canberra.
Bendigo has been outstanding. It's a very broad-based centre. It is a very collaborative and well-focused and widespread organisation that you have in Bendigo.
Bendigo Community Health Services first opened its doors as the Eaglehawk and Long Gully Community Health Centre in Bright Street, Eaglehawk on July 1st, 1974. Crucial to its development were David Kennedy as the chairman of the management committee, Denise Main as sister in charge, Bill Parker as secretary and Russell Hanson as the centre's first manager.
When I applied for the job, my mother and father came up from Melbourne to have a look at the building, and she said, "You're not going to give away 17 years in the bank for that, are you?" Golly, you know, working in a tiny little box like that.
The early days of the Bright Street Centre were busy and exciting. Overcrowding problems were solved when new premises were built in Seymour Street, Eaglehawk. The new centre was opened by one of the architects of Labor's health program, Dr. Sidney Sachs, in December 1976. These premises are located on top of the capped South Virginia mine.
Yeah.
I remember once in Scanlon, the health minister came up and there was some talk about, you know, this great mine shaft. And I think I said something like, you know, perhaps we could turn it into a drop-in centre. You're being our first patient.
With the advent of community health centres, the role of nursing expanded. Nurses were now responsible for education and information services and the implementation of community health programs.
When the health centre was established in Bright Street, people really saw it, first of all, as a medical clinic, and what our job was to do was to actually help the community to understand that it was more than that. It had a broader social health agenda.
So we've got examples of programs that have been introduced, such as women's health programs, childcare programs, the Centre Against Sexual Assault, heart health programs, programs for people suffering from cancer, which gives them information, and nutrition programs, and also the asthma program, just to name a few.
I guess, Di, one of the things that happened to me was driving the young mum's bus, and only to find that the hatch of the bus door hadn't been shut, so I lost all of the prams. No babies, but all of the prams. In Eaglehawk Road.
Not long after the establishment of the Eaglehawk and Long Gully Centre, Councillor Elaine Knight began pushing for a community health centre for Kangaroo Flat and Golden Square. In 1974, a steering committee conducted a survey which indicated that Kangaroo Flat and Golden Square were significantly disadvantaged as far as health services were concerned. A submission was successfully put to the then Minister of Health, Dr. Doug Everingham. Elaine Knight became the centre's first chairperson. A relocatable building was purchased and moved into Helm Street. These temporary premises were opened in March 1975 and were commonly known to the locals as the Greenhouse. The new permanent building was officially opened by Gough Whitlam in November 1976.
So, Gough, one of the great things about the community health program was that it actually helped attract doctors to communities in the country centres, and quite often also in the inner suburban areas.
You now had a doctor.
That's right.
Because he was assisted and subsidised by the community health services.
While the Eaglehawk and Long Gully Health Centre employed salaried doctors, some of the medical staff at Kangaroo Flat were employed on a fee-for-service basis.
Jean, we started much the same time in the late 70s. How did you find working in the community health environment?
Oh, I really found it was excellent. I really enjoyed the atmosphere there. I found it was very happy. The staff were happy. Everyone worked well together. We had a great general practice with services that were probably different than the private practice. You know, you had to live in the Eaglehawk area to have access to the service. And, you know, people were asked when they came to the desk where they lived, and if they lived within the red line, then they were permitted to come and use the medical service. And I mean, people even lied to get in because they wanted this facility for themselves.
Kangaroo Flat site was slightly different in that we were fee-for-service, but even so, when I arrived in 1978, the same sorts of things that you talk about was in that environment too. And it offered a bit more than what working in private practice in isolation offered. There was the sort of team approach to health, and also patients could meet a lot of their health needs within the building rather than be referred away.
A third community health centre was opened in the late 80s in White Hills. In 1991, under the auspices of the Eaglehawk and Long Gully Centre, there was a rationalisation of services. White Hills was closed down. Eaglehawk and Kangaroo Flat, along with the Playhouse and Bendigo Regional Drug and Alcohol Services, now came under the umbrella of Bendigo Community Health Services.
Bendigo Community Health is building on the range of services that have been here for 30 years, including children and family services, such as counselling, allied health services, podiatry and physiotherapy. We have also a range of men's health programs which have been very important to the men of Bendigo. We've also looked at and continue to provide services in schools and in the community, such as asthma prevention or chronic illness management. Physical activity is a really big part of our work, and just recently with Seniors Week we saw that seniors walking around the lake with our staff, so that's a really important part of it. And as well as that, things like family daycare and childcare have been very much there for 30 years but continue to build and grow.
The Playhouse Childcare Centre was established at a time when children's services were very new to Australia. It was rare that community health sponsored such a service, and we found ourselves in an enviable position where we were totally supported by our community-based committee of management.
The board is the link with the community, and the current board's particularly interested in that aspect because we think we should go back every now and then and talk to the community about, you know, are the services delivering what they want?
Drug and alcohol services were also responding to community needs.
Well, when my son died in the year 2000, there were 7 heroin-related deaths in a 10-day period, and it was just silent in Bendigo. And we thought we'd start this media campaign to try and bring the desperate need for services in Bendigo to the attention of the Bendigo community, because they just weren't aware there was a problem. And with the partnership that we formed with AA, Al-Anon and Families Anonymous and Bendigo Community Health, I believe we made really good progress, and we got the services.
Currently, over 140 staff work for Bendigo Community Health Services at 5 sites. There is a central branch in High Street, the Corporate Services branch in Don Street. Nova House in Holdsworth Road provides residential withdrawal units, and there are the Eaglehawk and Kangaroo Flat branches. One of the many programs at the Kangaroo Flat and Golden Square Centre is run by physiotherapist Trish Shanahan.
One of the highlights in terms of physiotherapy here has been the development of our Strong People Stay Young program, which is now in its 5th year. Been set up for people over 55 years of age, so people who undertake our program can do their everyday activities much more easily.
The working conditions and environment of community health centres provide satisfaction and stability for both staff and clients.
For me personally, because I have a nursing background, and my background has been everything from psych to general to midwifery to forensics to palliative, and it's always been a privilege to be there when a baby's born or when someone has gone to their God. And working in A&D has always been a privilege for me as well, because you're there when people are making major life-changing decisions, and it's an honour to be part of that.
Well, community health is like that. People didn't do it for the money, they did it for the love of it, and they still do.
I enjoyed community health, I think, very much, because prior to that I was in general practice, solo practice, and that's kind of lonely.
As a family, we were introduced to community health a very long time ago through my father, who was not only a patient but a member of the board. But I guess the most important things for us is the constancy and the trust that was built between us and our family GP, who was Barbara. Not only just as a young woman I was able to be a patient of Barbara's, but as the boys were growing up, it was really important that we had this person who was part of our community and very much part of our lives.
In March 2005, a picnic was held at Lake Nyanga to celebrate the 30th anniversary of community health in Bendigo. Past and current staff, along with members of the community, were invited to share in the celebration, beginning with a service which responded to the generations of families affected by mining. Bendigo Community Health today continues to respond to the changing dynamics of its community. In 1975, the Whitlam government was sacked in one of the most controversial events in Australian history. However, the legacy of that government lives on. Community health today is flourishing with the support of both Commonwealth and state funding.
Well, I'd like you to give my congratulations and well wishes to the Bendigo Centre, because I think it is outstanding in the range of services it provides and encourages, its cooperation with other community organisations,